Hi, this is Dr. Rob Lindsay, and today I've got diabetes treatment success number 5. Get your thyroid tested now. Now, I have treated hundreds of fibromyalgia and thyroid and diabetes patients over the years, and I have yet to see one in whom the thyroid wasn't involved in some level. Think about it. Your thyroid controls your body's metabolism. It has to be involved. Patients suffering from diabetes or fibromyalgia or whatever you want to call it can have a condition in which their thyroid is being attacked by their own immune system. This is called Hashimoto's thyroiditis. Most likely your MD has only ordered one thyroid test, which is TSH, thyroid stimulating hormone. If you're lucky, maybe he's ordered a couple more. Now, from your MD's perspective, if your TSH level is within a very, very wide lab range of 0.35 to 5.0, you're normal. There's nothing wrong with you. But the optimal level or functional level of TSH is 1.8 to 3.0. So you could still be normal in the medical doctor's eyes, but abnormal in the functional or optimal range. It's only when the range is above 5.0 that the medical doctor will put you on thyroid hormones such as Synthroid or levothyroxine. But as I mentioned, in a medical doctor's eyes, if your thyroid TSH is within 0.35 to 5.0, you are normal. There's nothing wrong with you. It's all in your head. You don't need medication because you don't even have a thyroid problem. And even though you still may have all the thyroid symptoms, fatigue, your hair's falling out, and so on, you're considered normal. Well, you and I both know that you are not normal. If you were, you would not be suffering from these symptoms. You could be within the normal TSH range of 0.35 to 5.0, but still be outside the optimal range of 1.8 to 3.0. Your TSH level could be 4.2, and that's why you're having the problem. It's outside the optimal or functional range. The same is true for any of the other thyroid blood tests, such as total thyroxine, free thyroxine index, free thyroxine, free triiodothyronine, that's T3, and the 3 or 4 other tests that need to be run on your thyroid to get the exact cause of your problem. Now, in diabetes treatment success number 6, we'll talk about the fact that the number one cause of hypothyroidism is an autoimmune thyroid, and that there has to be a reason why your body's attacking your thyroid. That's why we're going to address that in this treatment success secret. There are certain tests that need to be run on the thyroid, not just a TSH or a free T3 or a free T4. There are specific antibodies called TPO and TGB antibodies. If these antibody tests are positive, you have an autoimmune thyroid. My guess is that your doctor has not run these 2 tests. Now, there are many other tests that need to be run for the thyroid, but these are the 2 big ones to determine if you have an autoimmune thyroid. And if you're autoimmune, you have to find out why you are autoimmune. Remember, I said there are 2 parts to your immune system, TH1 and TH2. They need to work in balance. If one is dominant, or working harder than the other, it's usually because there's something called an active antigen. Well, what is an active antigen? It can be a parasite. It can be a virus or a bacteria or a mold. It could be a fungus. It can be a food protein such as gluten or a casein, which is milk protein. Your immune system could be imbalanced because of dysregulation due to hormone surges and or extreme stress. Blood sugar problems and or chronic inflammation and or cortisol levels can all cause your immune system to run amok. Again, don't wait around. Get checked. 952-949-0676. I look forward to seeing you on our next Success Secret.